In the past few weeks, an increasing number of kids in Texas are being hospitalized with COVID-19. KVUE's Connor Board talked with one Central Texas doctor who's seen this influx of patients firsthand.
As the Omicron variant spreads, it is infecting people old and young.
We've also seen kids with COVID that are being hospitalized. Certainly in our hospital, that percentage has crept up rapidly in the last 10 days to 2 weeks.
Dr. Dominic Lucia works in the ER at McLane Children's Hospital in Temple and is the chief medical officer. He says just 2 weeks ago, they only had about 1 to 2% of their hospital beds occupied by COVID-19 patients. Now that number is nearing 12%, and the beds are filled with a variety of kids.
Can be kids that don't have a lot else. We've seen some younger kids that have the sort of those significant viral symptoms that actually need some help as far as breathing. And we see it also with kids with complex medical histories where it causes more problems.
He says the kids who are vaccinated are either not being hospitalized or are having shorter stays. Although he believes Omicron has overall less severe symptoms, he says it's risky to assume your child will be okay.
Our pediatric infectious disease experts are seeing kids that have long-haul COVID symptoms and can have other issues secondary to COVID even weeks later.
As kids head back to school, he has a few tips.
If you're 5 and up, eligible for the COVID vaccination, get it. If you're eligible for flu vaccination, which essentially is all ages, get it. And then the secondary measures, which are important right now, which would be the masking, which would be the hand washing, which would be the social distancing.
In an email to parents, Austin ISD recommended double masking if kids don't have an N95 mask. Dr. Lucia says there is no harm in double masking, but finding a good mask is most important.
If we can just start with a good quality, mask, medical mask with the elastic, that's a really good start.
He believes socially it's best for kids to be in the classroom, but says January is going to be a challenging month as he expects more kids to be hospitalized with the virus.
Where we're at right now during the break, and then we're going to go back to school, it's probably going to get worse before it gets better.
Reporting in Austin, I'm Connor Board.
You can watch our full interview with Dr. Lucia on the KVUE YouTube channel.